Hey everybody, it's Dr. Eric Nepute. Welcome to Pep Talk. I hope you're having an amazing day wherever in the world you are. I hope you're doing well. Listen, on this edition of Pep Talk, it's Ask Dr. Eric. You guys know you can go to our website, go on there and ask any questions for your health, your wealth, or whatever you got going on, and we're going to answer those. So today, I'm going to go through in the next 30 minutes and answer as many questions as I can that you have all sent in. So folks, let's buckle in. Let's get after it. Let's rock and roll. So here we go. First question here. This is from Jim in Ohio. Jim says, hey, Dr. Eric, love what you do. Appreciate all your hard work. Thanks for standing up for the truth. Love you, brother. Thanks for tuning in. So his question is about mental health. He said, look, since the pandemic has hit, he's noticed an increase in anxiety, depression, and insomnia in himself and his 13-year-old child. What do you suggest? The only options that he's getting right now is medication that he's tried and didn't work. So, man, that's a loaded question, brother. That's a big one, but let's get into it. So I want to take a little different approach when it comes to mental health. So the first thing I always ask my patients is, if you feel like crap, which is typically what happens when you have a mental health issue, you don't feel well. My question is, are you eating well? Are you moving well? Are you sleeping well? Are you breathing well? And are you communicating well? Because if you're not, you can't be well. Let's break those down. Look, if you're eating the standard American diet, the diet that consists of a tremendous amount of processed food, chemicals, there's over 1,000 chemicals in our food supply that are hormone disruptors, that are endocrine disruptors, that are known carcinogens that can cause inflammation in your body, which then can cause inflammation in your blood, which then can cause inflammation in your brain. That could be literally one contributing factor to why you have anxiety, depression, insomnia. What about if you're eating those same foods or other foods that might be healthy foods, like certain vegetables that are high oxalate vegetables like kale, like spinach. You know, kale and spinach, people are doing kale and spinach smoothies and juices all the time. Some people cannot handle those oxalates. And if you look at an oxalate, Joe, under a microscope, it looks like Jim, it looks like a little piece of glass. And it's cutting up your intestinal tract. And you may say, well, what does that have to do with mental health? What does my gut have to do with mental health? Did you know that 90% of the neurotransmitters are the chemicals that are produced in your gut that go up to your brain and tell your brain to be happy, to be motivated, to feel good? They all come from the gut. So if you have a condition called leaky gut, you're going to have a condition called leaky brain. And what happens is that's where some anxiety, some depression, some things can come from. Now, look, there really are brain patterns that happen with PTSD and stress traumas. And man, trauma is a huge thing. And I'm Dr. Eric, not Dr. Phil. But I know there's a lot of physical, chemical, and neuroemotional techniques out there that can help you improve upon this. But the data is really clear. In my opinion, there's nothing better to start with whenever you have anxiety, depression, or any type of mental illness than, number one, to start eating better. So I'm going to give you some tips right now on foods. Then I'm going to give you some nutritional tips. Then I'm going to give you some movement tips that you can do to help improve the quality and function of mental illness. You decide to do those medications, that's your decision. Totally support you doing it or not doing it. I would advise you to consult your physician about the risk and benefits of all those. But let's talk about diet first. So we have a serious problem in our society with overconsumption of carbohydrates, especially refined processed carbohydrates, breads, pastas, barley, oats, white rice, things of that nature. Most humans don't handle and process those foods properly, especially if they're GMO foods, because they have glyphosate on them. Glyphosate is a known carcinogen and a known endocrine disruptor that can cause leaky gut, which is when our intestinal tract starts to separate and our cells become permeable. And now the toxins of our gut get into our blood, and then they get into our blood-brain barrier and cause a leaky, toxic brain. So getting foods out of your diet like breads, pastas, grains, barley, white rice, oats, getting them out could be huge for you. Getting dairy out of your diet could be huge for you. Most people are allergic to dairy. Most people cannot handle certain types of dairy. Now, I'm not saying that you're lactose intolerant. There are people that have that, but most people have sensitivities to dairy. And did you know that early exposure to cow's milk is one of the number one reasons why kids get ear infections whenever they're young in the first place? It's in the data. Go look it up. So avoiding dairy, avoiding those processed grains we talked about are huge. Some other things I would avoid is I would avoid drinking water from a plastic bottle or from your tap. Did you know that just recently the EPA has come out just this last year and said that there is no safe level of fluoride in the human body? No safe level of fluoride in the human body. Well, they've been giving us fluoride in our toothpaste. It's in our medicinal, it's in our municipal, I couldn't say the word. It's in our municipal water supplies. And those chemicals we know lower IQ, cause leaky gut, cause inflammation, and can lead to depression, anxiety, and insomnia. Cut that stuff out. So what should I eat? What should I eat is I should eat good, clean, healthy foods. Good, clean, healthy foods. I'm a big fan of clean meat, you guys. Now, I know some of you are vegetarians, and I'm completely fine with that. I have no problem with that. I think vegetarianism is good. Pescatarianism is fine. But I'm going to tell you, I have a lot of people that have been sick over the years because they haven't gotten enough protein in their diet. Some people find it very difficult to have a plant-based diet to get enough protein in it. Some people don't, but most people do. So I like good, clean, grass-fed beef. I like good, healthy, clean meats like bison and venison and things of that nature if you can have access to it. All things in moderation, even moderation. I also like a lot of vegetables in the diet, but low oxalate vegetables. So oxalate high vegetable, you can go Google or go on our website. We've got a list of oxalate vegetables on there, but go just Google high oxalate vegetables. Taking out of your diet things like kale and other roughages like spinach can be a game changer. I just had a woman who had the very same problems that you were doing. She couldn't lose weight, anxiety, insomnia, depression, fatigued all the time. She's starting to lose her hair because her thyroid's jacked up. We put her on more of a carnivore type diet, took out all of the processed food out of her system. We took out the oxalate vegetables. Within 3 months, she lost 17 pounds. Her energy's higher than it's ever been. She's a former Division I softball player, and she's rocking and rolling now, has 4 kids at home, and just is killing life again. So little simple changes can lead to a huge potential for you. Cabbage. Eating cabbage and fermented foods are powerful. Cabbage soup is so good for healing the gut and healing the brain. Fermented foods. Kimchi, kombucha. I love sauerkraut. I eat sauerkraut, multiple servings, sometimes per day of sauerkraut. It's so healthy for your gut bacteria. Those are some powerful things that you can do. What about hydration? Well, I like to use water filtration systems that pull the chlorine and fluoride out of the water and infuse it with minerals. Like spring water has minerals in it. Distilled water doesn't. Reverse osmosis is okay if you have a system like that. Any filtration is better than no filtration. But what I use in my personal home is I have a machine that, by the way, is on all of our water we drink and the water that we shower and bathe in. It is a machine that pulls the fluoride and chlorine out of the water, but also infuses it with hydrogen and also infuses it with minerals. It makes the water a little bit more alkaline. We know that if your pH is above a 7, then you're typically going to have better outcomes with your electricity of your body, right? The pH is a measurement. It's a chemical measurement of the electricity in your body. And you can measure your own pH. You can go get some litmus strips from, the supply store, Walmart, Walgreens, anywhere has those. And if your pH is above a 7, that lowers the risk of a lot of, health challenges, including mental health challenges. What about supplements? Well, there's a couple of them that we recommend right out of the gate for what you're dealing with. Number one is methylated B vitamins. I would highly encourage you to get on an L-methylfolate and a B12, which is called methylcobalamin. Methylated B vitamins can help folks that have a genetic imbalance called MTHFR. MTHFR, I'm going to tell you, is in about 60% of the population. Some people say it's less. Some people say it's more. It's in a lot of people. It basically is a gene defect that doesn't allow your body to handle gluten and doesn't allow your body to handle unmethylated B vitamins. So one of the other things you can do is pull all gluten out of your system, which there are a lot of gluten substitutes that are out there, gluten-free substitutes that could be beneficial. But add those methylated B vitamins. Number 2, get yourself on a solid probiotic that uses master microbes, not just a cultured probiotic that has a bunch of bifidobacteria and lactobacillus, but master bacteria. I'm a big fan of that. That and eating fermented foods can repopulate that gut bacteria, which can help your brain function like it's supposed to. Also, from a supplement standpoint, vitamin D3, D as in dog, D3. You guys have heard of seasonal affect disorder, right? SAD syndrome. In the winter and in the fall when the sun's not out as much and we're not getting exposed to the sun, our body doesn't make enough vitamin D3, and that can lead to depression, anxiety, and mental illness. We know that could be a part of it. And so those are really like the core 3. The B vitamins, there's 2 of them, the probiotic, and then the vitamin D. The last one is magnesium. And I like magnesium glycinate or chelated magnesium. By the way, for magnesium, what we typically recommend for somebody to take is take your body weight, so you know how to dose it. Take your body weight, take that number times 10.6, divide that number by 2.5. That's how many milligrams a day you should be getting as a supplement of magnesium in your system. And make sure it's a chelated form or a magnesium glycinate, easy to absorb, very inexpensive, really works phenomenal. And then, man, move your body. Your muscles are like battery chargers for energy in your body. The more we move it, the more energy we have. Like your body needs to make something called ATP, adenosine triphosphate. And that ATP, it can't be made proper if we're not moving. And we live in a world where we're very stagnant these days. And by the way, your children are stagnant. They're sitting in a chair in a classroom for 6 to 8 hours a day without movement. No wonder little Billy's getting in trouble all the time, because his body's supposed to be made to move. And if we're sedentary, that leads to more of those problems. So look, there's a lot more that we can get into with that, but those are some simple things. I would encourage you to start with that. And once you get that mastered, then we can move into some other things. So there's yours. Okay, here's another one. Okay. All right. So this is Lisa from Minnesota. Lisa's asking about long COVID syndrome. Okay, so we're finding this with tens of millions of people around the globe right now. After they've either been injected or infected with COVID-19, they're having this massive fatigue issue. I want to tell you what's really going on. The latest research shows that this is an ATP production problem. It's a mitochondrial deficiency, a mitochondrial disorder in the body. The mitochondria inside of your cell of your body is the powerhouse, right? You guys remember that from like 7th grade? The mitochondria is the powerhouse of the cell. Well, inside of your cell, there's all these little machines in there. That's literally what they are. They're these little bitty machines inside your cells that are working together to produce energy, to make new tissues, to do all these things. Well, that mitochondria, for whatever reason, in certain percentage of people is dysfunction because of that infection of that type of a virus or the injection of that type of a compound. Here's what we found. We found that number 1, detoxifying the body is absolutely paramount. Well, detoxifying the body involves several things. Number 1, it's hydration. You can't push toxins out unless you're hydrating like you're supposed to. So I'm going to encourage you every day, the first thing in the morning, what I want you to do when you get up is I want you to get a good full glass of clean water. And you already heard how important it is to have spring water or filtered water or reverse osmosis, or hopefully water that system that pulls out the fluoride and the chlorine out of the water and puts minerals in it. But if you don't have that, what I want you to do is I want you to go get some key limes or some lemons, if that's all you can do. Key limes are better than lemons, but you take one of those and you cut it in half and you squeeze half that lemon or lime in that water. And I want you to put a big healthy pinch of good organic sea salt in there. And I like Himalayan pink salt. I like Baja Gold salt. I really like Celtic sea salt. It just needs to be good, clean, organic salt. That salt has 70 to 80 different minerals in it. Those minerals are electricity for your body. The more electric your body is, the better it can push toxins out. So first thing in the morning, start doing that. And then if you want to really kind of kick that up another little level, put a little pinch of cayenne pepper in there. Cayenne pepper moves the blood. It'll improve circulation. Man, it'll also help you a lot with cravings as well. The second thing I would encourage you to do is start doing some intermittent fasting. We know that the body, when it's fasting, goes through a process called autophagy. Autophagy is cells healing themselves, cells getting themselves to get rid of the old bad cells and regenerate new ones, new healthy cells. And hopefully, if we have new healthy cells, we have new healthy mitochondria. So what we recommend is starting with a small fast where you're skipping breakfast, you're going and maybe having lunch around 1 o'clock, maybe noon, but then you're eating your dinner maybe around 6 or 7. So you're eating within about a 6-hour window and you're fasting for 18 hours. That's a really great way to fast, to get your body used to doing that. Now, once you get used to doing that, I'm going to recommend that every once in a while you do 1 meal a day. Then I'm going to recommend that you get used to doing some prolonged fasting. We know that doing fasting for 24 hours up to 36 hours is really the key in resetting the body, but you got to work your way up to that. And it really is powerful. The data and research is clear on this. I'm going to show you some other things that are really beneficial. Nattokinase. Nattokinase is a supplement that you can take that has been shown to help with conditions like long haulers. You heard me talk about before with the mental health issues with methylated B12 and methylated folate. So L-methylfolate and methylcobalamin are two great things that you can do to really improve the ATP production in your body. That's a big one. Also, the other things that you can do is make sure that you have a solid probiotic, a probiotic that has master microbes in it. These are great things that you can do. That master microbe will help get a bacteria back inside your intestine called bifidobacteria. Bifidobacteria seems to be the key in most cases with long COVID syndrome that really show a massive benefit. That bacteria has been proven to be one of the most important bacteria to improve the function of the immune system and ultimately the function of cells. Now, if you have the ability to do something called orthomolecular nutrition, which is IV vitamin therapy, that also is very beneficial. As a physician, I've been doing IV vitamin therapy for over 18 years now, and mega doses of vitamin C with glutathione, sometimes some NAD, but those things work amazingly to improve ATP function and detoxification of the body. There are also lots of detox baths that people can do. I'm just a good old-fashioned fan of taking a bath in Epsom salt. At least once a week, I'll get in the bathtub and I'll soak for a good hour with at least 1 pound up to 3 pounds of Epsom salt in that water. That magnesium gets in your body. Epsom salt is 90+% magnesium, and it'll pull a lot of toxins out of your system. And that magnesium has been a really great benefit to improve long hauler syndrome as well. The last thing I'll tell you that we use in our practices very commonly is we take an excretion of a stem cell called an exosome. And doing exosome IVs have been really beneficial in doing improvements with long haulers. There's other things you can do, like just get out and exercise, get your body moving, using hyperbaric therapy, doing deep breathing exercises. There's so many things that can be done to improve the quality and function of the long haulers. All right, let's look at another one. So we got a question here about sleep. Okay, this is a local guy. This is a young man from St. Louis who says, Dr. Eric, I'm having serious issues with my overall health, but man, my biggest issue is sleep. I started having insomnia when I started college a couple years ago. I got into bad sleeping habits, and I know it's wrecked my health. What can I do to improve my sleep hygiene? So, okay, sleep is a big issue. Because what I want you to understand is the only time that you can really truly heal is when you're sleeping. We know that if you're not sleeping adequately, you're going to gain weight. We know that it's going to increase blood sugar issues. We know it's going to reduce hormone function. We know it's going to improve all kinds of chronic inflammatory or increase all kinds of chronic inflammatory disease. We know that. So the reality of it is that most people can get away with 6 to 8 hours of sleep per night. But there's a group of people that have a gene imbalance in their body called MTRR. And if you have that gene, you need just a little bit more sleep. These are folks that need a good 8 to 10 hours of sleep every day. And if they don't get those 8 to 10 hours of sleep every day, their body doesn't function like it's supposed to. So let's talk about things you can do. The first thing I would suggest that you do, number one, is make sure that you're eating clean throughout the day. All the stuff that I was talking about with the mental health and also the long COVID applies to you from a food standpoint. Intermittent fasting is a powerful thing. Making sure you're staying hydrated is a powerful thing. Having adequate amounts of fluid in your diet throughout the day is an adequate amount a thing to do. But burning off energy, get your body moving, man. Get up in the morning, go for a walk, or go for a walk after lunch, or go for a walk after dinner. Did you know that going for a walk after you consume food can lower your blood sugar up to some cases by 30%? That's a powerful thing. And most people can't fall asleep or stay asleep because of blood sugar issues. If we control the blood sugars through diet, exercise, and intermittent fasting, that by itself can help with the sleep issues. There are some things that we do recommend for sleep that help. There are certain peptides that have been proven to help with sleep. Peptides are a type of amino acid that have been very popular now for really about 20 years, but the last couple years have really kind of gained notoriety in the public. But peptides like BPC 157, ipamorelin, the C-Max, those kind of, and C-Link, those 4 peptides have been shown to be very beneficial to help with sleep. Also, making sure that you have adequate amounts of vitamin D. If your D levels are not between a 60 and a 100, then man, you're not going to be able to get that deep sleep. There are other things that you can do. I actually am a fan of taking melatonin. There's peptides that help the body make melatonin. And there are a lot of scientists or doctors out there that are poo-pooing melatonin. That is absolutely ludicrous. I'm sorry, but it is. Now, just like anything, we don't want to abuse it. And you should cycle on and cycle off, but I'm a fan of melatonin. I will tell you that me personally, I probably 3 nights a week take between 25 and 35 milligrams of melatonin before I go to bed. And that's not a mega dose. Melatonin also helps the immune system function better. So there's multiple uses for that. There's also other things that you can do, like deep breathing exercises. If you go online and look up diaphragmatic breathing exercises or what's called box breathing, you can use box breathing exercises, which basically is a form of deep breathing and meditation that can help you go to sleep and stay asleep. There are technologies that are out there. I'm a big fan of using technologies to tap into your brain, and there's technologies that you can use that you can wear these goggles and headsets and you can listen to this soothing binaural beats and meditative music and relaxation therapies to help your brain waves get back to balance. And this will also help you not just fall asleep, but stay asleep. By the way, you can also use this technology during the day, and 20 minutes of using this brain technology can actually be the equivalent of a 4-hour power nap. And by the way, I'm not opposed to naps. I think it's okay for you to take a nap a couple times a week to get caught up if you need to. But there are so many things, but really it's more about avoidance than it is about taking things. Before you go down the road of buying a bunch of supplements and taking a bunch of peptides, the first thing I would do is say this: 10 hours before you go to sleep, 10 hours before you go to sleep, no caffeine. No caffeine, 10 hours before you go to sleep. About 3 hours before you go to sleep, no food. And about 4 hours before you go to sleep, no alcohol. Caffeine can affect your sleep for up to 10 to 12 hours. Alcohol and food can affect your sleep between 3 to 4 hours. And your brain and your gut are on the same type of wavelength. So if you're digesting food, your brain can't sleep like it's supposed to. So there are so many things that can be done. In fact, if you go on our site, there's videos on there that I do specifically about sleep and sleep issues. But I'm telling you, most people, if we get them sleeping well, if we get them breathing well, eating well, exercising well, taking the right supplements and avoiding those things that could be, causing problems, guess what happens? They sleep fine. So I would encourage you to try those first. If that does, give that a good solid 6 weeks. If after 6 weeks you don't see any change in that, then you holler back at us and you let us know, okay? So I hope that makes sense. Okay, I'm going to do one more. Let's do one more Ask Dr. Eric question. This one is on gut health and microbiome. This is one of my favorite topics. So leaky gut, this question is about leaky gut. Dr. Eric, could you talk about leaky gut syndrome? My health issues include digestion, immune problems, and I've got some mental health issues. They've heard me talk about gut health before. So let's discuss leaky gut. So here's the deal with leaky gut. I'm going to tell you that 95% of Western medicine or Western eating diets don't get enough fiber. If you don't have enough fiber in your diet, you can't make the right bacteria in your gut to heal your gut. And so 95% of the population in Western societies are going to have leaky gut syndrome. Leaky gut leads to all kinds of other problems, including, like I told you, insomnia, anxiety, depression, fatigue. All the data is out there, okay? So let's clean up the gut. How do we do that? Intermittent fasting, number one, is a powerful thing to do. Just like I talked about before, eating 2 meals a day or occasionally 1 meal a day. But when you are eating during that feeding time, you're eating a lot of nutritionally dense foods. That's when you take your vitamins. That's when you take your supplements, all during that window. What else can you do to heal your gut that's leaking? Man, I love fermented foods. Eating foods like, kimchi, kombucha. I told you cabbage soup. Man, having cabbage soup regularly is amazing. Juicing with celery is a powerful thing to do. By the way, we found that juicing with celery doesn't increase or spike your insulin, so it can be done during a fast. And most people have no problem with it. Now, I would encourage you to have a glucose monitor or do something to see if those juices spike your insulin, but most people, celery juice doesn't do that. I would encourage you to up your fiber. Make sure that you're getting good plant-based foods in your diet and avoiding oxalate vegetables, avoiding things like, kale and spinach. And in some cases, cruciferous vegetables could be a problem. Usually cruciferous vegetables like broccoli and cauliflower can help heal the gut, but in some cases it can cause more harm than good. Another big thing is avoid white flours, gluten, and things like almonds, almond flour, almond butter. Those can tear the gut up as well. Putting yourself on a really good probiotic, having a prebiotic, and that probiotic needs to be a master micro probiotic, and then eating good healthy fats like ghee butter. Ghee butter and extra virgin olive oil have been shown to help heal the gut. I tell people, make sure you're getting at least 1 to 2 ounces a day in your diet of extra virgin olive oil. Man, that's amazing. Using butter like ghee butter, which is a special type of butter that comes from, cows that are grass-fed cows, that can help your body make butyric acid. And that butyric acid, butyrate, can actually help heal that gut. So I would encourage you to go look at some of the webinars, seminars, and things that we've done. It's on our website about leaky gut and things you can do to improve it. But if you'll start there, that'll help you. Start with the simple things. There's no one-stop shop for all things. There's no one-stop vitamin to cure all things. There's no one cure-all pill that's out there. You've got to go and find out what's best for you. And precision testing can lead to precision treatments. That's why I recommend finding a functional medicine doctor like myself. There's doctors all across the globe that do the work that we do. So folks, there you go. Listen, I want to encourage you to please make sure that every week you're sending in your questions. Go to our website. You can type your questions in there. Make sure you're following us on all of our social media platforms. And folks, until we meet again, I'm Dr. Eric Nepute. God bless you. God bless America, and God bless the world. Stay smart out there, folks, and I'll see you soon. Be well.